Have you ever woken up in the middle of the night with an unusual tingling or burning sensation in your feet or hands? Perhaps you've felt pins and needles that seem to persist no matter what you do. You might have even mentioned it to your doctor and been told it's just age. While it's true that our bodies change as we get older, there's so much more to nerve health than aging alone. Peripheral nerve discomfort, sometimes called neuropathy, is a common experience affecting millions of people. But the underlying cause is often overlooked, and in many cases it can be addressed, or at least significantly improved, through careful attention to nutrition, lifestyle, and certain medical interventions. Understanding the mechanisms behind nerve health is the first step toward regaining comfort, mobility, and confidence in your daily life. How nerves work. Inside the human body, there are roughly 45 miles of nerves running from the brain and spinal cord to every part of the body. These nerves carry signals that allow you to feel sensations like touch, temperature, pressure, and pain. Each nerve is protected by a coating called myelin, similar to the insulation on an electrical wire. Myelin keeps signals flowing smoothly. When it deteriorates or is damaged, signals can become misfired or interrupted, leading to sensations like tingling, numbness, or burning. Peripheral neuropathy occurs when these nerves are injured or fail to function properly. While neuropathy can result from many factors, including diabetes, infections, or trauma, vitamin deficiencies are one of the most common and preventable contributors. Why vitamin B12 matters. Vitamin B12, also known as cobalamin, plays a central role in maintaining healthy nerves. Every nerve cell relies on B12 for two critical processes: repairing the myelin sheath and producing energy within the cell. When B12 levels are insufficient, the myelin covering can degrade, and the nerve cell's energy production can falter. This combination can contribute to the development of neuropathic symptoms. A deficiency may not produce noticeable symptoms at first, but over time, nerve function can become impaired, leading to discomfort, reduced sensation, and sometimes difficulty with balance and mobility. Factors contributing to B12 deficiency. Many people are at risk of B12 deficiency without realizing it. Certain medications, such as metformin, commonly prescribed for type 2 diabetes, and proton pump inhibitors, used to manage heartburn, can reduce the body's ability to absorb B12. Age is also a factor. As we grow older, stomach acid production naturally decreases, making it harder to extract B12 from food. Individuals following plant-based diets may be particularly vulnerable, as natural dietary sources of B12 are predominantly animal-based. Over time, these factors can combine to create a situation where the body is not getting enough of this essential nutrient, even if blood tests appear normal. The early warning signs. Peripheral nerve issues often start subtly. Tingling in the fingers or toes, mild numbness, or a pins and needles feeling are early signals that something might be off. Many people dismiss these sensations as minor or attribute them to aging, but they are often the body's way of signaling that nerve health may be compromised. Detecting these early signs and addressing them promptly can prevent more serious complications, while severe nerve damage can sometimes be irreversible. Early intervention gives the nervous system a chance to repair itself. The history of vitamin B12. The discovery of vitamin B12 is a fascinating story that highlights its importance. In the 1920s, Doctors were puzzled by a condition called pernicious anemia, which caused extreme weakness, pale skin, and severe neurological symptoms. At the time, it was considered fatal. Researchers discovered that feeding patients raw liver reversed these symptoms, eventually leading to the identification of vitamin B12. This small molecule, containing a cobalt atom at its core, earned 2 Nobel Prizes for its discovery and structural identification, underscoring how vital it is to human health. How B12 supports nerve health. Vitamin B12 performs 2 essential roles for the nervous system. First, it supports methylation, a chemical process that converts homocysteine, a potentially harmful amino acid, into methionine, which is critical for building and maintaining myelin. Without sufficient B12, homocysteine can accumulate, potentially affecting nerve function. Second, B12 is necessary for energy production in nerve cells. It supports mitochondrial function, the tiny powerhouses inside each cell, helping nerves produce the energy required to maintain signaling and repair damage. When B12 is deficient, this energy production falters, contributing to symptoms like fatigue, tingling, and numbness. How to assess B12 status. Standard B12 blood tests may not always reveal deficiency accurately, particularly in the early stages. Functional tests, such as measuring methylmalonic acid, MMA, and homocysteine levels, can provide a clearer picture of whether cells are receiving enough B12. Elevated levels of these markers often indicate that the nervous system is not getting adequate support, even if conventional blood tests appear normal. Understanding these nuances can be crucial in preventing long-term nerve damage. Choosing the right form of B12. Not all B12 supplements are created equal. Many over-the-counter products contain cyanocobalamin, a synthetic form that requires conversion by the body into active forms. While effective for some people, others, particularly those with certain genetic variations, may struggle to convert it efficiently. Methylcobalamin and adenosylcobalamin are the bioactive forms of B12, directly usable by the nervous system for myelin repair and cellular energy production. Hydroxycobalamin is another form that the body converts easily and is often used in clinical settings. Choosing the right type of B12 can make a meaningful difference in recovery and ongoing nerve health. Supplementation and delivery methods. The method of delivering B12 is also important, especially for those with absorption difficulties. Oral tablets can be effective for people with normal digestive function, but sublingual forms, which dissolve under the tongue, bypass the digestive system and enter the bloodstream directly. In cases of significant deficiency or active neuropathy, intramuscular injections may be recommended to ensure that therapeutic doses reach the body efficiently. Regular monitoring and guidance from a healthcare professional can help determine the most effective regimen. Dosage considerations. Maintenance and therapeutic dosing are distinct. For general health, daily supplementation of around 1,000 micrograms of methylcobalamin is often sufficient. However, for individuals experiencing neuropathy or significant deficiency, higher doses, sometimes ranging from 1,000 to 5,000 micrograms daily, may be appropriate for several months. Research shows that these therapeutic doses can improve nerve function, reduce discomfort, and support myelin repair over time. Personalizing the dose based on laboratory results and symptom severity ensures the most effective support for nerve recovery. Supporting nutrients. B12 works best in conjunction with other nutrients that support nerve health. Active vitamin B6, pyridoxal 5-phosphate, and methylated folate support methylation processes. Vitamin B1, thiamine, particularly in specialized forms, helps protect nerves from stressors such as high blood sugar. Magnesium supports healthy nerve signaling and helps calm overactive nerves. Antioxidants like alpha-lipoic acid, ALA, protect nerve cells from oxidative stress and have been shown to reduce symptoms in neuropathy patients. A nutrient-rich approach ensures that B12 can perform its roles effectively and supports overall nerve resilience. Dietary sources of B12. While supplements are essential for many individuals, particularly those with absorption challenges or dietary restrictions, food remains a vital source of vitamin B. This nutrient is naturally found in animal-based foods, making it critical for maintaining healthy nerves, blood cells, and overall energy levels. Among the richest sources of B12 are organ meats, particularly liver, which has been valued for centuries as a nutrient powerhouse. Even small portions of liver provide more than the daily requirement of B12, making it a potent option for restoring low levels. Other organ meats, such as kidney, also contain significant amounts of this essential vitamin. Shellfish, including clams, mussels, and oysters, are another excellent source. These foods not only provide B12 but also contain other minerals that support nerve and cardiovascular health, including zinc and selenium. Fatty fish, like wild-caught salmon, sardines, and mackerel, are especially valuable because they provide both B12 and omega-3 fatty acids, which help maintain healthy cell membranes and support anti-inflammatory processes throughout the body. Grass-fed beef is another accessible option, offering not only B12 but also high-quality protein, iron, and other nutrients that support muscle and nerve health. Eggs, particularly those from pasture-raised hens, contain beef in addition to choline, which supports nerve function and brain health. High-quality dairy products such as yogurt, cheese, and milk also provide beef in bioavailable forms. While these foods may seem modest individually, integrating a variety of them into daily meals can help maintain steady B12 levels naturally. For those following plant-based diets, obtaining adequate B12 from food alone is extremely challenging. Most plant foods contain either no B12 or inactive analogs that the body cannot utilize effectively. While fortified plant-based products, like nutritional yeast, fortified plant milks, and breakfast cereals, can provide some B12, supplementation remains essential for vegetarians and vegans. Combining a balanced diet with targeted supplementation is often the most reliable approach for long-term nerve health. A well-planned diet ensures that B12 intake is consistent, helping the nervous system remain resilient and responsive. The importance of early intervention. Nerve damage does not usually occur overnight. It develops gradually over months or years, which means early symptoms can be subtle and easily overlooked. Tingling or numbness in the hands or feet, a slight burning sensation, or occasional weakness may seem minor, but these signs are the body's way of signaling that the nervous system may need attention. Recognizing these warning signs early allows for proactive measures, preventing more severe complications that could affect mobility, coordination, and overall quality of life. Early intervention begins with awareness. People often normalize symptoms or assume that they are a natural part of aging. While aging does influence the body, it is not a guarantee that nerves will deteriorate. Simple steps like testing B12 levels, adjusting diet, and ensuring proper supplementation can make a significant difference. Functional B12 testing, including methylmalonic acid and homocysteine levels, provides a more accurate picture of cellular B12 status, helping identify deficiencies before they result in irreversible damage. Addressing early signs also empowers individuals to take ownership of their health. Timely action supports the nervous system's natural repair mechanisms, which can be remarkably resilient when given the right tools. By paying attention to subtle changes in sensation, balance, or strength, people can intervene before more serious symptoms develop, preserving both independence and quality of life. Lifestyle factors for nerve support. While supplementation and diet are critical for nerve health, lifestyle factors also play a central role. Maintaining balanced blood sugar levels is particularly important for individuals with diabetes or prediabetes, as high blood sugar can contribute to nerve stress and damage over time. Consistent monitoring, alongside dietary adjustments and physical activity, can help stabilize glucose levels and reduce strain on the nervous system. Regular exercise improves circulation, which ensures that nerves receive adequate oxygen and nutrients for repair and maintenance. Low-impact activities, such as walking, swimming, or yoga, can enhance blood flow and support flexibility, while strength training helps maintain muscle mass, which is essential for mobility and balance. Gentle stretching also keeps joints and connective tissues healthy, which can further reduce the risk of nerve irritation. Smoking and excessive alcohol consumption are known to increase oxidative stress and inflammation, both of which can negatively impact nerve health. Reducing or eliminating these habits provides the nervous system with a more supportive environment for repair. Similarly, stress management is crucial. Chronic stress releases hormones that can interfere with cellular repair processes and nerve signaling. Techniques such as meditation, deep breathing, mindfulness, and adequate sleep allow the nervous system to recover and function optimally. Combining these lifestyle strategies with proper nutrition enhances the effectiveness of B12 and other supporting nutrients. Magnesium, for example, helps regulate nerve excitability, reducing overactive signals that may cause tingling or pain. Antioxidants like alpha-lipoic acid protect nerve cells from oxidative stress, and active forms of BX and folate work alongside B12 to support methylation, myelin repair, and cellular energy production. Together, these approaches create a comprehensive plan for maintaining and restoring nerve health. Monitoring and long-term maintenance. Once B12 levels are restored and nerve symptoms begin to improve, ongoing monitoring is essential. Blood tests, particularly functional markers such as methylmalonic acid and homocysteine, help ensure that B12 levels remain sufficient for long-term nerve health. Regular follow-ups with a healthcare provider allow for adjustments to supplementation, diet, and lifestyle, preventing deficiencies from recurring and reducing the risk of future nerve damage. Long-term maintenance also involves integrating supportive habits into everyday life. Ensuring a consistent intake of B12-rich foods, continuing supplementation as needed, managing stress, and maintaining physical activity all contribute to sustained nerve function. Awareness of subtle changes in sensation or mobility should prompt reevaluation, as early detection is always preferable to addressing more advanced nerve issues. Collaborating with a knowledgeable healthcare professional provides reassurance, guidance, and the confidence to make informed decisions about nerve health over the years. A message of hope. Peripheral nerve discomfort can be challenging, but it is not inevitable or untreatable. With proper attention, education, and proactive measures, it is possible to preserve nerve function, reduce discomfort, and maintain independence. Vitamin B12 plays a central role in this process, supporting both the repair of protective nerve coatings and the production of cellular energy. Many individuals who once struggled with persistent tingling, numbness, or burning sensations have experienced meaningful improvements by combining B12 supplementation, supporting nutrients, dietary adjustments, and healthy lifestyle practices. Recovery is often gradual, but the nervous system has a remarkable capacity for healing when it receives the nutrients and conditions it needs. While patience is required, the positive changes are tangible. Individuals report improvements in sensation, sleep quality, mobility, and overall well-being. For those facing nerve challenges, understanding the causes, taking informed action, and maintaining consistent habits can restore comfort and confidence in daily life. Taking the first steps. If you recognize yourself in the descriptions of early nerve symptoms or risk factors for B12 deficiency, there are practical steps to begin today. Start by discussing functional B12 testing with your healthcare provider. These tests offer a more precise view of cellular B12 status, helping to identify deficiencies before they lead to serious nerve damage. Next, explore supplementation options, focusing on bioactive forms of B12, such as methylcobalamin, adenosylcobalamin, or hydroxycobalamin. Sublingual forms or injectable options may be particularly effective if absorption is a concern. Reviewing your diet is another key step. Aim to include B12-rich foods like liver, shellfish, fatty fish, eggs, and dairy in your meals. For plant-based eaters, fortified foods and supplements are essential, supporting nutrients such as B6 in its active form, methylated folate, B1, magnesium, and antioxidants like alpha-lipoic acid can enhance the benefits of B12, contributing to nerve repair and function. Finally, adopt lifestyle practices that complement these nutritional strategies. Engage in regular physical activity, manage stress, maintain healthy sleep patterns, and limit habits that can negatively affect nerve health, such as smoking and excessive alcohol consumption. These steps together create a strong foundation for nerve repair, long-term wellness, and quality of life. Conclusion: nerve health is complex, but it is manageable with knowledge, planning, and consistent care. Vitamin B12 is not just another supplement. It is a critical nutrient that supports the structure and function of the nervous system. By recognizing early signs of deficiency, seeking accurate testing, taking appropriate supplements, and embracing supportive lifestyle habits, individuals can protect their nerves, reduce discomfort, and preserve mobility and independence. Neuropathy and nerve challenges do not have to be an unavoidable part of aging. With informed action and proactive care, nerves have the capacity to heal, and individuals can experience meaningful improvements in comfort, function, and overall well-being.